At Atos Health, I think we focus more on delivering a service rather than generating products. And the key thing for us, and which our chief exec talks a lot about, is focusing on our customer's customer. So in the NHS, what it means is focusing on solutions and services that help clinicians and patients. So what that means is four key pillars across healthcare that we work across. I think the first one is about integrated care. This is about using technology, using collaborative solutions to work across the health economy, whether it's community services, acute trust, mental health trust. And the key thing is that bringing all that together such that we can somehow improve the patient experience. The second one, which is linked to integrated care, is about collaborative care. And when I say collaborative care, it's not just about giving patients the right care, but it's helping their carers and their families. Especially in the UK, when we've got an ever increasing aging population, people with long-term conditions, equally important for delivering that care are our carers and our families. So putting in digital technologies, innovative solutions, that's ensuring that families, friends and carers are there to support and help patients. The third element is about mobile care. And this is two elements, I think two facets to it. The first one is about personalized healthcare. Again, coming back to the patient satisfaction and the patient experience, so giving patients access to data and information, their own records. And then linked to that, which is the second element, is about improving efficiency across the hospital. So using mobile technology to better utilize resources rather than reactively managing it, proactively managing the demand. So that's mobile care. And the fourth one is about care analytics. And this is using data, but it's not just clinical data, it's lifestyle data. So the wider access to information coupled with clinical data to allow clinicians to better inform medical decisions and deliver care. So it's mainly around integrated care, collaborative care, mobile care and care analytics. So that's what Atos focuses around. How we do that in a number of streams. I think that in terms of products and services, the first one, we're starting at using our Atos consulting to really help and inform organizations in where they are, because we do accept that the NHS was one organization, it's made up of a number of different organizations in terms of trust. All of them are not at the same place. So what we need to do is really understand where organizations are in their journeys and therefore design a solution to get them up to where they want to be. So it's using the consulting arm of our business. And then the second thing is making sure the core foundation is right. So what we are specializing and focusing at the moment is core foundation IT. Because what we don't want to do is to put new technologies and new solutions on poor infrastructure. So focusing on core infrastructure is the second element. And the third element is probably working with partners. So you'll find that we are very much technology agnostic. And what that means is we go to the market, we have some very key niche partners like Microsoft, Xerox, and then we also have some very small partners like Total Mobile, right? Or ProReal that can really help us bring in niche solutions that they really understand that could better benefit the NHS. So it's really working across that spectrum in terms of delivering a service that focuses on our customer's customer, which is patients and clinicians. I think the first thing is kind of understanding the outcomes that we're trying to achieve. It is not saying it's one solution or it's our solution. It's really making sure that we understand the outcomes, and generally it's the clinical outcomes. And what we're looking for is technologies that can facilitate that clinical outcome. So once we understand that, is then putting together the right solution. So I mentioned just now about working with partners. At the moment, one of our key solutions is working with some of the EPR providers, because that entire end-to-end clinical journey, whether it's an Epic system, whether it's a Cerner system, it's almost neutral. The idea is focusing on the outcomes that those clinical systems are trying to achieve, and then how we as a service provider and a business process organization can really restructure those processes, facilitated by technology, bringing in the best of class of providers to deliver those solutions. And the key thing is taking risk is the first one, and the second one is making an investment to deliver those outcomes. And what I like about Atos is that to be held accountable, not to deliver a solution and walk away, because that's what the contract says. It was understanding an outcome that the NHS wants to achieve and us taking responsibility to deliver that outcome. I think the first one, which is more people related, it's a cultural change. I mean, you've got an NHS organisation that has comes in leaps and bounds over the last 50, almost 60 years now. However, you do have a culture that's somewhat resistant to technology changes. I think the first one is the adoption of new technology, and therefore the time and effort is to get the users to see the benefit. And coming back to my previous answer, is that I think if we can take technology and the solutions to make it outcome focused, I think we will overcome that barrier. So I think the first barrier is the cultural adoption that the NHS and us as providers needs to work jointly towards to get the wider population across the user base more comfortable, more trustworthy of the solutions. That's the first one. I think the second one is infrastructure. It's the age-old infrastructure that the NHS uses at various stages, and how we can work together to, at the right pace and at the right point of kind of modernize that technology. It's absolutely right to have a paper-light solution by 2023, but how do we put the right building blocks to get that? And I think one of the biggest challenges is obviously the infrastructure. And then finally I would add, which I really do feel for anybody working in the NHS, is whilst we know what the problems are, whilst we know what the solutions might be, the NHS is always under significant pressure just to deliver today's solutions and today's problems, which is give patients care. That's ever burning platform. So I think what we need to do is work to the NHS to create that capacity where you are working on a day job, but organisations or individuals across the organisation has the capacity to think strategically for the next 6 months, the next 12 months, the next 60 years. And how we make that work is creating that capacity. I think that's the challenge. I think a couple one from an IT perspective. I think it's the use of data. I know we all talk about big data and analytics, but if we take, other industries and the way we use data, I think that will really grow exponentially. However, I think the challenge, and I hope it's not a barrier, is the control and the use of the data and the security of the data. But I think the first thing is the way we really use data to really inform clinical judgments. I think that's the first one. The second one, which is also linked to data, is to improve efficiencies. Really using data to know what NHS trusts are procuring and what NHS trusts are buying. To really use data to know the usage of buildings, property usage. And then the final one is to really use data to know how you're managing your workforce. So I think that the use of data, will really grow, not just for clinical, but also for operational facilitation of efficiencies across the NHS. I think that's the first big changes that we'll see. I think the second change, which is kind of linked to that as well, which is more what I think is the automation. Right? And again, it's kind of using data, but it's not getting people to use data. It is get people to add value, but using things like AI, maybe not, but certainly robotics. And we look at other industries, whether it's retail industries or maybe to some degree the banking industry. They've now used data and they're now starting to use robotics. And I think the benefit for the NHS, it's probably to some degree has been proved in other areas, in other industries, that where we across the health space can leverage that. So I think it's around data. And I do think the final one, in terms of the rapid change we will see, and I come back to my very first point of the challenges, I think you will see a mindset, and a mindset from users in terms of delivering care, from clinicians, and also from patients. Because I think at the end of the day, patients, however sick or unsick we are in terms of using services, want a consumer experience and that patient journey. And I think we will get a shift and an acceptance from both patients, clinicians, and the NHS that this is the way we require service, and therefore this is the way the NHS should adapt to that. And what I mean by that is in various channels. And it's a case of, it's not just one channel, because some people, doesn't matter on age, will say, actually, I want to pick up the phone to my GP. But you get some people, again, agnostic on age, it says, actually, I want to do everything on my mobile app, or on the internet, or online. And I think giving patients the adoption of those various channels will probably be, and the acceptance of those various channels will probably be one of the key exponential growth areas that certainly I think we will see in the next 2 to 3 years, because we are getting those services in other parts of our lives. I think for a number of reasons. I think the first one is the networking. And when I say network, it's not just having a chat. I think it's networking across the NHS. It's facilitating that. I think sadly and unfortunately, quite often when I talk to individuals across the NHS, I find that some of them don't really talk to their colleagues in the neighbouring trust or in the local economies or in trusts that are doing something different, where they've got kind of moving in the right direction and that learning. So I think events like this create the opportunity for NHS colleagues to have that time. As I said before, it's always fighting fires. It's very hard for them to take time off. I think events like this really create that environment. And secondly, of course, you would expect me to say this, it gives us suppliers and partners to the NHS the opportunity to understand two things, really what the NHS is thinking in terms of where they plan to go. If anything, it kind of hearing it again just cements what we already know. And the second thing is talking to some of our, I call it competitors, but it's the market. Because we might be competing against each other, but actually we are trying to deliver the best solution for NHS partners. So understanding what we are doing as providers and partners to the NHS on the supply side is equally important that we talk to each other as much as we like the NHS to talk amongst themselves. So I think events in this facilitate those two elements really, really good.